I'll be speaking on Zepto assisted Capsulorhexis in Intumscent white cataract. Basically, Zepto is an innovative disposable device that is used in cataract surgery that uses precision pulse technology method. It's accurate, it produces reproducible capsulotomy, which is quick, safe, and affordable. Bionosis is a US-based company which marketed it in 2016 after FDA approval, and within months of its inception, it became so popular, and as a low cost and a better alternative to femtosecond assisted laser surgery, and in present Indian scenario, it became very relevant. To understand how this happened, we must know a little about how this works. Basically, it consists of a silicone suction cup, a nitinol capsulotomy cutting element, and an incision push rod system. Nitinol is an alloy with a good memory function. It's an alloy of nickel and titanium. The console generates suction and brief train of electrical pulses. The undersurface of the device tip reveals the nitinol cutting ring, which is surrounded by the suction cup, and there is a retractable push rod which either makes it small or make it large depending upon the stage of surgery. This is the pictorial depiction. It has a console, a disposable tip, and this is the undersurface of that suction ring made of silicone, and that metal ring, the nitinol cutting alloy ring. When compared to femtosecond, we can see how simple the machine is. And obviously, with simplicity comes cost, and its maintenance and its installation. Now, how it works? It generates, the handpiece generates suction and a brief train of electrical impulses. The undersurface, which I'll show an animation. The handpiece is inserted through a 2.2 or 2.8 incision, and that is done through the manipulating the push rod system. And once inside the eyeball, the anterior chamber, it is gently apposed on the capsule, and after centering it with first Purkinje image, suction is generated. And after the suction, optimum suction is generated, one can fire the electrical impulses, and that completes the capsulotomy. It is as simple as this. And when we are faced with this kind of cataract, that is intumescent cataract, we definitely want a result of this kind. This is something we don't want, but this is very quite common, and it can derail the whole surgery. So what is the solution? We can either go for a Zepto or a femto. Both of them give predictable capsulotomy in this scenario. Now, what Zepto does is gives precision, and it does the process very safely. Why it is precise? Because there are no chances of extension, and safety because the capsular margin is quite tough, and it is predictable and reproducible every time. It is also suitable for patients with corneal opacities and small pupil, something which I have to think or it's not possible with femto-assisted Capsulorhexis. And hence the patient gets a sharper vision with almost zero complication rate, at least related to the step of Capsulorhexis. And the cost factor, I will come later, it is much less than what femto second laser cost. And obviously, the surgical time is very much reduced because the whole procedure, the electrical impulse, it takes about 4 milliseconds, and the whole procedure takes less than, I would say, 1 minute to complete. This is a surgical video. It is introduced through the incision, the push rod is withdrawn, and that suction ring assumes its shape, and it is gently apposed. Now it can be nudged gently under the iris because the pupillary dilatation is not adequate. And once it is apposed gently, suction is applied, and that we can make out by seeing the bubbles. And when the bubbles are seen and the suction is complete, see the bubbles moving out. When that is complete, we can fire the electrical impulses, which takes hardly 4 milliseconds to complete the cut, and the rhexis is done. This is all. It is simple as this. And finally, the outcome is this. We get a clear-cut capsulorhexis, well-centered, and with a proper overlapping of the IOL. Femto achieves the same thing, but obviously at a higher price. What are the advantages we get with Zepto? Obviously, there is a reduction in surgical time. It is versatile and it is efficient. The efficiency part we have already seen. Versatile because it can be used in corneal opacities. It can be done in small pupils. And in small pupils, Zepto is a clear winner with a win-win situation. And when coming to the cost factor, considering the present market rate, Zepto is it is only 3.75% of what a femto-LASIK costs. So it can be in the armamentarium of every cataract surgery, and every cataract surgery can extend the benefit of Zepto to every patient. And moreover, Zepto creates capsulotomy in one motion, which gives strength to the capsular edges also, whereas femtosecond capsulotomy, it creates capsulotomy in micro pulses, and there are chances of tear extension if not properly done. Pupillary dilatation, I have already mentioned, it should be at least 5 millimeter. Opacities and degenerations they have limited use, and cardiac patients on pacemakers, they can't be advised to go for femto-assisted capsulorhexis. So these are the other recommendations which is not part of the topic. So the take-home message is that Zepto is so cost-effective and so efficient. It is well comparable to a femto-assisted capsulorhexis, and it should be in the operating theater of every cataract surgeon. Thank you.